All right, intervention techniques. The term's interchangeable with both skills and styles. Here's 4 of them. There's a soft intervention. Think extra gentle. Why do you do this? Softly intervening is appropriate when the counselor doesn't know the client well, has an established rapport, or knows that the style works best for them. It maintains a non-confrontational approach. Examples of that. Raising your hand during a group session subtly signals that the client might want to reconsider their statement or is monopolizing the group. Making eye contact is nonverbal communication, which signals concern and encouragement to the client. Facial expressions are a great way to softly intervene. There's also the universal timeout. The second type is passive intervention. This isn't an immediate action. Why? Passive intervention is used to avoid embarrassing or has an inappropriate timing. It is a non-intrusive approach. When do you do it? Not at the time. You recognize that to prevent discomfort. Some examples: addressing a specific issue later in the group session to prevent immediate embarrassment. Waiting until the end of the group session to provide feedback on a client's behavior. Engaging with the client one-on-one after the group session when it is more private and less confrontational or embarrassing. The third type of intervention is an assertive one. Think direct and concise. Why do you do this? Well, assertive interventions are employed when safety is compromised, inappropriate behavior, or language is displayed. Other things are disrespectful behavior or boundaries that need to be set. It ensures a swift and clear response. When do you do it? Immediately during or right after the behavior takes place, because learning is most effective when the client's behavior is corrected promptly. Allowing them to correlate consequences with their actions. Some examples of assertive statements. Number 1, I understand your perspective and I need to remind you that the behavior you exhibited is not acceptable in our group. 2, it's essential that we maintain a respectful and safe environment here. Your comment crossed the line and we won't allow that behavior in our group. 3, I appreciate your willingness to express yourself, and it's crucial to remember that we have guidelines for communication within the group. 4, your safety and the safety of our group is the most important to me. Your behavior puts you and others at risk, and we need you to stop it immediately. 5, I see the passion and emotion in your words, but it's essential that we all act respectfully and considerately. Let's discuss how we can refocus your energy in a way that aligns with our group's guidelines. The fourth intervention, which is an aggressive intervention, there may be times when this is appropriate, but we're not teaching them in this class at this level. So we're going to get some practice with the other 3. Here are the types of interventions. I'm going to give you a brief summary along with an example for each. Number 1, clarifying. Why do you do it? To ensure clear understanding of what the group member is trying to convey. When do you do it? Whenever a group member's statement appears vague or ambiguous. Or when you observe group members looking confused. Or when you're confused. Example, could you clarify to the group what you meant by, I don't feel great? Are you referring to physical health or something else? Number 2, interpreting. Why do you do it? To offer insights to a group member's behavior or emotions. When do you do it? When a group member's actions or statements might benefit from a deeper understanding. It's also when it's needed for if a concept is too complicated for everyone to understand. It's also needed when clients are at different stages of treatment and or change. Example, it seems like we may be using humor as a defense mechanism to cope with our anxiety. How many of our group members also do this? Number 3, meaning attribution. Why do you do it? To help group members find value and understanding in their experiences. When do you do it? When a group member's narrative could benefit from an applied meaning. Example, to the group, overcoming challenges demonstrates strength and determination. Number 4, summarizing. Why do you do it? To consolidate and clarify the main points of a discussion. To conclude group. To help everyone feel a part of the group. And to reinforce learning. When do you do it? At various points during the group session, particularly when a recap is needed. Also, when I'll tell you that every group needs a summary. And then you'll also do it to summarize and create a conclusion or a transition. Here's an example. To summarize our discussion today, we explored the impact of stress on our daily lives and strategies for managing it. Number 5, interrupting. Why do we do it? To prevent unproductive or potentially harmful conversations. When do you do it? When a discussion goes off topic or becomes distressing. You also do it when you see unhelpful defense mechanisms or behaviors. Example, I'm interrupting this conversation as it seems to be causing distress. Or, I'm not comfortable with what's going on. Then assertively stop. We're done with this conversation. Number 6, redirecting. Why do you do it? To guide conversations back to the main focus of the session. When do you do it? When discussions veer off topic or become unproductive. Or when you're asked a direct question. We'll go over that another time. An example, let's redirect our conversation to the initial goal, which is discussing effective coping strategies. Or let's redirect the focus to a more positive topic. What does the group think? Does anyone have experience or insights related to this topic? Number 7, deflecting. Why do you do it? To encourage groups discussions and shared knowledge when a question is beyond the counselor's expertise. When do you do it? Well, when faced with questions outside the counselor's area of knowledge. It's similar to redirecting. Example, send it back to the client. Well, what do you think? Or we're not going there. Number 8, extending the conversation. You do it to deepen discussions by inviting group members to elaborate on their thoughts and feelings. You'll do it when you want to encourage deeper self-reflection, while also inviting a client to participate more, or when you need to fill time. Examples, can you elaborate on that thought? What are your feelings about that situation? Tell us more. Number 9, extracting. You do it to pull out more important information or details from a group member's story. You do it when that is required, and you'll also do it when you need a quick response. Example, could you be more concise? Can you summarize the events leading up to that moment? What's one word that describes your feeling or perspective? So remember that this list isn't an exhaustive one, and there are differences between each of the interventions. If you're struggling to understand what the differences are, we've got another video that may be able to help clarify. That's it. We just went over all the interventions I'd like you to know.